Hi and welcome to Herida Healthcare Moving and Handling Limited. We've created a range of videos which are used to support instruction of how to best apply each sling type. Our videos are to be used as a guide only, so please note that a full assessment must be taken by a qualified carer in every instance prior to a lift. First, a thorough inspection of the sling, binding and webbing must take place. If it's worn, torn or ripped in any way, then please discard and do not use the sling. Equally, make sure that you're aware that the sling and hoist demonstrate the maximum user weight clearly, and also that you are aware that the patient you are about to lift fits comfortably within the maximum weight limitations. The sling must also have an individual serial number that allows traceability for its model and design. Slings with loop attachments must be applied to hook-type spreader bars with loop configuration, and slings with clips must be applied to peg or clip-type spreader bars with clip configuration. Never use either design on a non-configurable spreader bar. It can often be intimidating being hoisted for the first time. Therefore, always clearly communicate your lifting intentions whilst providing reassurance both beforehand and throughout the lifting process to your patient. The patient and sling hoist falls into the regulations of LOLA, or lifting operations and lifting equipment, and PURE, provision and use of work and equipment regulations, and must be treated as such. For further information, please visit the HSE website at hse.gov.uk. The Trent is a reliable, classic, universal sling design which has been refined for both standard transfers as a primary use whilst having the ability to use in a multidisciplinary, seated or bathing applications. This easy to use and popular product design ensures a perfect fit to the user's body whilst providing a total support and stability. This includes patients who may have severe disabilities. This product can be manufactured in a variety of sizes and materials. Ask the patient to lean forward, supported by the carer as necessary. Place the sling behind the patient's back in a seated position as shown. Avoid any pinching of skin areas or nipping areas of body mass. As the sling has been applied behind the patient, ease the leg sections carefully under each limb. Feed the straps through the dignity hoop section as shown. If the sling is to be used on an amputee patient, please ensure the leg stump is accommodated safely within the housed leg section and that the centre of the straps do not rub on the leg. The Trent may be used with the leg tips between the thighs using the grey loop, or across both legs using the black loop. This should be decided by the clinician. As the sling and patient are comfortable, reduce the height of the spreader bar, avoiding the patient's face and head at all times. Place equal coloured straps to either side of the spreader bar, ensuring that the correct and comfortable position is achieved. Please note that some patients' clinical conditions may require various colour applications, and as such, a trained carer must always conduct this activity. Tighten the straps by hoisting under tension, gently until lift is ready. Communicate the process to your patient throughout the procedure. Always raise the bed to waist height to minimise stress on the carer's back. Ask the patient to roll onto their side if capable of doing so. If the patient needs assistance to roll, this should be done at the shoulder and hip areas. As the patient is placed on their side, roll one half of the sling and tuck tightly onto the back and buttocks as shown, taking care not to pinch the skin. Lay the remaining sling straight in readiness for the next process. Roll the patient over to the other side of their hip and unroll the sling so that it's fully open and interfacing with the floor or bed surface. Place the patient carefully on their back and gently pull out any creasing. The ideal position for the patient's hands is for them to be placed by their stomach or by their side during this process. If your patient's on the floor, lower the spreader bar and open the legs of the hoist around the patient's head. If your patient's in bed, the legs of the hoist should be placed underneath the bed. Place the leg support sections underneath the legs and feed the straps through the dignity hoop before applying to the spreader bar. You can then apply the head section straps to the spreader bar using the matching loop or clip colours. This procedure should be followed unless the patient's clinical condition dictates otherwise. Raise the spreader bar gently, ensuring that no nipping of the skin or unnecessary pain is transferred to the patient. Regular communication and reassurance should be provided to your patient throughout the process. The spreader bar or strapping, if selected, on the rear of the sling can be used to steady the patient during the lift. A full risk and safety assessment should always be conducted with the patient and surroundings prior to any lift. Do not attempt to lift any patient during any circumstances without the appropriate training. Moving and handling vulnerable patients is a serious business, and Herida do not endorse unsafe or underqualified staff throughout any lifting process. If you're unsure, please contact a supervisor or line manager within your workplace who will be responsible for the correct procedural lift and training policies within your site.